Welcome, everyone, to Let's Talk. Our session today is titled Doing Something Differently, Lessons Learned from a Case Study Using Implementation Science to Guide Program Change. I'm Debbie Mathias from the BUILD Initiative and the Director of the QRIS National Learning Network. Before we begin our session together, I'd like to thank the Alliance for Early Success and other generous funders for making this learning community possible. We began this series for state quality administrators and leaders to support their important work within states around early learning systems building. Quality administrators are welcome to invite other participants as related to the specific topic of the call. We know several of you invited colleagues interested in continuous quality improvement, professional development and technical assistance, implementation, and other cross-sector partners such as Head Start, education, and early intervention. We intentionally keep the sessions small to invite conversation and sharing. We hope these calls enable us to illuminate challenges, innovation, and promising practices. After the session, a survey will pop up asking for your suggestions, comments, or questions. We appreciate your input and ideas about this session, and we'll follow up with resources as requested. Also, thinking ahead, let us know if you're working on a promising practice or facing a challenge in your state systems building. Send me an email and we can develop a Let's Talk discussion around the topic. I'd like to thank you for taking the time to answer the questions when you registered. Many of you provided thoughtful ideas and questions. We reviewed the information, and it's informing this presentation. Make sure to keep notes during the session for our discussion near the end. I know I have my paper and pencil ready. Enter your thoughts and ideas throughout in the chat box so we can reference your experiences and questions. The practical use of implementation science as a tool to inform program quality improvement is a subject of great interest to states as they aim to improve child outcomes and school readiness. Working with program directors to create a reflective culture in teaching and learning while implementing and improving best and research-based practices in the classroom provides a sustainable trajectory to improving services. I'm excited to hear about real-world examples of implementation science and use, and think together with our session participants about how the Rowan experience can be generalized in other contexts. I'd like to hand the presentation off to Kelly Perkins and Zainab Erjan. Thank you, Kelly and Erjan, for sharing your story with us today, and it's all yours.
Thank you, Deb. We are really excited to be here with everybody today. My name is Kelly Perkins, and I am joined by my colleague Zainab Erjan, and we are excited to get started. Zainab, do you want to say hi so everybody can recognize your voice too?
Hi, everyone. We're so excited to join you today and share our work at Rowan through implementation science. Kelly and I are so excited for today.
Yes, and we'd also like to just give a quick reference to Laura Johns, who is one of the co-authors of this presentation but was unable to be with us today. So to get started, we're going to go over some of our objectives that we kind of put together as we were thinking about how best to share this experience that we had at Rowan University. So primarily, we really want to create a space for a dialogue on how implementation science can be more accessible as a tool to really help guide and focus the quality improvement initiatives that are currently underway in so many different states and territories. Also, to provide opportunities to discuss ways implementation science can inform technical assistance, to discuss the role of implementation teams, data and feedback loops, and infrastructure as key drivers for program improvement. So really taking apart those three core elements of implementation science. And you'll see that woven throughout our presentation. And also to discuss the role of program administrators. And we're really focusing here in this presentation on the power and the heavy role, the critical role that program administrators play as change agents in initiatives, such as CCDBG reauthorization and also the QRIS. We know that early care and education program administrators are often called on to make changes happen in their programs. We can see that across the field. For example, the November 2014 signing of the Child Care and Development Block Grant Act provided new requirements for programs utilizing the CCDF funds for child care subsidy. And this act defines health and safety requirements for child care providers. It outlines family-friendly eligibility policies and requires that parents and the general public have transparent information about the child care choices available to them. And while states are required to ensure the implementation of the CCDBG standards via different changes in the policy, it is the program administrator who stands at the helm of the actual program level change process. Similarly, we see this within quality rating and improvement systems that have emerged as a framework for early care and education quality improvement, both within the state and also at the regional level. But again, on-site program administrators are responsible for navigating and implementing these new quality improvement policies and practices. So those are our main objectives that we're going to be focusing in on today. We're really looking forward to hearing from you all a little bit more as we move forward. And I'm going to hand it over to Zainab, who is going to ask you all a few questions.
Hello, all. At this time, we would like to get your feedback in your role. So what types of quality initiatives are you currently involved in? And we would like you to please type it in the chat box. I know that you won't be able to see those, but we're able to see those. So tying and connecting your roles will be important in our presentation. Okay, I see some are involved in the local QRIS systems. And just state, if you could state your role in that initiative, that will be helpful for us too. QRIS county-wide, funder, wonderful. Home visitation. And if you could also put in what is your role in that QRIS system. Quality Services Manager, oversees QRIS program, wonderful. All right, seems like overseas state QRIS. A lot of you are in the administrative roles, overseeing QRIS systems. TA, we have some technical assistant specialists, coaching and mentoring. Wonderful. PD specialist, wonderful. All right, thank you so much for this feedback. If you want to continue, go on in. Anytime if you have a question, put your questions in the chat box, please. Great.
Okay, great. Thank you, Zainab, and thank you, everybody, for letting us know kind of where you're situated within your work. So let's talk a little bit about what is implementation science. So implementation science is a specific study of the process of making evidence-based practices work in real-world settings. And you see this quote up here that is from one of the briefs that we've cited throughout this that we'll be sharing with you in a few minutes. But you see that implementation science is important because when you scale up a program to reach more children and families, we want to make sure that we're achieving the desired outcome. So why are we focusing on implementation? Well, this presentation is really designed to help make implementation science more accessible as a tool for quality improvement for early care and education program administrators. The application of implementation science within early care and education programs really places an overt emphasis on the evaluation and the reflection, which is so foundational to our practices. It also really helps to support frontline leaders as they identify what is and then also what is not working for children, staff, and families across all early childhood settings. Just to give you a little roadmap of where we're headed throughout this presentation, we're going to give you a short introduction about the theory that's helping to guide our work with our case study at Rowan University. And then we're going to share the process of implementing a quality improvement initiative at Rowan University's Early Childhood Demonstration Center. And we're really hoping that this field-based illustration will help to demystify the drivers and the stages of implementation science to really help focus on the concrete application of implementation science, as well as the very important aspect of integrating data to support program-level continuous quality improvement. So there is that CQI approach that we're really working within this entire presentation as well. So to get started, we want to give you a quick introduction to implementation science. Based on the feedback that we got from the questions that you answered when you first registered, all of you at least have a beginning understanding of implementation science. Some of you said that you have a deep understanding of it and also that it's embedded in a lot of your work. And then there were a few that also had kind of like an intermediate level. So this is just a very brief overview to kind of make sure we're all situated around implementation science from the same approach. So all of the I'm about to share is highlighted from the brief and integrated stage-based framework for implementation of early childhood programs and systems from 2015. I encourage you to read it. It's a great synopsis of what implementation science is and how the field has kind of moved towards a better understanding of it as well. And so we know based on the theory of implementation science that there are 4 specific stages that when you first integrate or begin a new program, initiative, or innovation that the implementation will go through. And those 4 stages are exploration, installation, initial implementation, as well as full implementation. And a little bit later on, as we kind of dig deeper into the case study, we're going to talk more about each one of the stages. And as well as going through each one of the stages, we're also going to be sharing a little bit about the 3 core elements that are important that exist within each one of the 4 stages. And those core elements are implementation teams, data and feedback loops, and implementation infrastructure. So I'm going to share a little bit more about each one of those 3 core elements. And the first one is around implementation teams. And implementation teams are the who of implementation. So they are individuals whose primary purpose is to monitor and support the implementation as it goes up to scale. So it's an organized and active group. Sometimes it's multiple groups that really support the implementation, also the sustainability of the implementation, and also the scaling up of that innovation towards full implementation. And here on the slide, you see a few questions, and these questions are really designed to help frame the development of an implementation team. So when you're approaching getting ready to start implementing a new initiative or a new innovation, it's really best to think about these kind of questions so that we're being very intentional as we're designing our implementation teams. Because, and as you'll see within the case study, this was a core and really foundational, important act that we did was to put together the implementation team. So thinking about things like who needs to be involved, what are the different roles that exist in the implementation team, and how many teams are needed, but then also what should team members know or be able to do? So what's the level of knowledge and skills for the members of the team? And just as another note, just to keep in mind is that, we really see that implementation teams, there's this active involvement component to it. It's not a passive group. It's very active. there is a commitment to this group. It takes time. There is a time commitment as well. There is most likely, in most circumstances, a need for a specialized expertise. And then also this team needs to be accountable to the implementation moving through the stages. And then the next core element that we'll be talking about a little bit as well is around data and feedback loops. And data and feedback loops really must be embedded throughout the process of implementation. And these questions that are on the slide in front of you are also designed to help you think about how to plan for data collection and then also how to utilize the data. And we really know and see that it's really paramount that there is constant interaction between the implementation team and your data and feedback from the field as you're, scaling up a project. Checking your data, listening to the feedback that comes in, it gives you this really unique and really important opportunity to be able to pivot throughout the project so that you can quickly change the process to make sure that you're achieving your goals that you're really focused on. So once again, these are just some questions that can help us think about how to use data and feedback loops. So to make sure we know what questions we're trying to answer as we're seeking data. What is the data that we should be collecting and why? How are we assessing? How are we collecting feedback? How are we then going to be using the information, the data, to support practices in CQI? And then also, how do we integrate those policy practice feedback loops, that plan, do, study, act? And then the third component is implementation infrastructure. And, some people refer to the implementation infrastructure as the building blocks. So these are the building blocks that are needed to really push the practice and the organizational and systems change. So Metz and Bartley talk about that they're the building blocks of the essence of the implementation infrastructure. And once again, you see that these questions that are up here are designed to help you think about how to tackle this core element. So, do we have the right team to do the job? Thinking about the implementation team, and then also thinking about later, as you're designing, if you're designing an innovation to be implemented within like a certain program, is the staff there? Do they have the knowledge and skills there at a staffing level to be able to implement this specific innovation? How are we recruiting, training, supporting? Think about coaching. Coaching is coming into this as well. And then, the monitoring and supporting aspect of the quality of the delivery of the new implementation. And then also thinking about resources, partnerships, policies to really make sure that we have this high quality delivery of whatever the new practice or innovation is. Also thinking about the leaders, and we know that leadership plays a vital component of this as well. So are the leaders responsive and capable and ready to be able to do these particular innovations that we're trying to implement? And then also, how are we inspiring the innovation as we go about doing this? So these were just a quick, brief overview of the three core elements of implementation science that are going to be, as we move on and get into the case study, really helping to frame the work that we did at Rowan in each one of the stages. So I'm just going to pause here and see if anybody has any questions or comments. Or Deb, if you have any comments or anything at this point.
No, Kelly, that was a great description of the basics of implementation science. And I don't see any questions about how you laid out the starting place for us prior to the case study. I would like folks to think about if you have used implementation science. We'll circle back at the end of the case study and be interested to hear what you're finding and how you might have tried to use that strategy in their state as a tool for continuous quality improvement or within a QRIS framework. So be thinking about that. If you have used or thought about using implementation science, we'll be interested to hear from you later. But with no questions, let's proceed into the case study. Thanks.
Great. Thanks, Deb. All right. So I'm going to turn this over to Zainab, who will share a little bit about Rowan University's Early Childhood Demonstration Center.
Hello, everyone. All right, so our work at the Rowan University's Early Childhood Demonstration Center began in 2014 when Kayla and I became a part of Rowan University for the first time. But I'll just share some basics about the center. The center serves children for ages from 2.5 to 6 years old, potty trained, and it has 2 rooms. One is a mixed age group across all of these ages. Another one is a specifically designed pre-K classroom based on parent needs and feedback. And the center has the center had traditionally, in their website and in their program, a simple, description around developmentally appropriate practices, growth of the whole child, individual child, and then a focus on content area learning. And it's basically play-based, and curriculum is designed around the centers. And beginning our work with the center, it was only open to members of the Rowan University. It serves staff, faculty, as well as students. Students has a subsidized rate, and staff and faculty had a full tuition. And again, it was only open to the center. And just remember these facts when you're talking about the stages and what changed from the original description.
Great. Okay, thank you, Zainab. So as a way of describing how we utilized the core elements that we talked about a few minutes ago, we're going to be moving through each one of the stages of implementation. So we're going to move through exploration, installation, initial implementation, and then full implementation. So just to start us off, just to frame the conversation, the stage 1 of exploration is a period of time that's typically associated with discovering what change is wanted or needed to improve quality and outcomes. So the what could be a change in policy or practice, and typically the results of this phase will include a decision regarding what your initiative or change will be, as well as an implementation plan that includes tasks, timelines, budgets, and an outline of different human resources that are needed. So as we entered into the first stage, as Zainab had just shared, we started this work in 2014 when we first joined the faculty at Rowan University, and we began meeting with the program administrator. And just to give some more context, at the same time, New Jersey's QRIS had launched in the state, and while investigating the readiness for the program to enter into the QRIS, the program administrator and the faculty agreed to try something new, to begin to try some sort of quality improvement effort. And we didn't know what that was going to be. We just knew that we wanted to do something different and that we wanted to do some quality improvement initiative. So really, to guide the focus of the quality improvement, we conducted a needs assessment. And so to begin, a series of meetings with the faculty, the program administrator, and the staff took place to discuss options for quality improvement at the center. We gathered data from each one of the meetings, and then we analyzed it, and then we brought it back for review by the whole group, just to make sure that we had that whole loop of data really ready to help guide our decision making, because we really wanted to guide the decision making process to use as much data as we could. So really quickly, it became evident that we needed to do more than just this smaller needs assessment that we kind of had started with. So the faculty helped the program administrator intentionally plan a data collection for an additional needs assessment. So the program administrator collected additional data through informal conversations with different stakeholders. She went back and went through previous exit interview information from families. Teacher feedback was garnered. There was also a push to look at children's work samples and their portfolios that we had on hand. And then the faculty conducted formal and also informal observational assessments in each one of the classrooms. We also collected data using some informal interviews with stakeholders such as previous faculty, and then also other community stakeholders around the university and around that local community. So what happened is, after reviewing this data and really discussing and evaluating where we were in the readiness to change scales, it became evident that the center really needed to adopt a new curriculum, and that was going to be the push that we were going to be going for. It came up, just kind of rose right up to the top through all of the data. So it became apparent that the current curriculum was outdated and was really not responsive to the needs of children and families in the way that we know, should be best practice. So generated from these preliminary meetings, as well as the needs assessment, the goal of the Quality Improvement Initiative was to adopt an inclusive curriculum which was culturally responsive to the needs of children and families. So we went back and talked with the university administration, department faculty, the program administrator, and staff and families to ensure that they all supported this new initiative. So that's kind of the nuts and bolts of how we got there and how we made the decision to, through the exploration stage, to really start to, have this new endeavor of this new curriculum. So I'm going to turn this over to Zainab now, who is going to share about how in this first stage of exploration, how we utilized the three core elements of implementation science, which you can see here on your slide.
Kelly, before you move on, I had a quick question. You mentioned a readiness to change scale. What was that feature, or can you say a little bit more about that?
Yes, so we had looked at a number of readiness to change resources that were out there, and you're going to have to forgive me, Deb, I think it was the Children's Institute one that we had looked at originally to assess where people were in regards to being ready to change or not. We really wanted to be very intentional that we were not coming into this particular program and saying, we think that you need to do this. We wanted to make sure that the staff was also feeling confident and capable and ready and able to undertake this change. And you'll see as we continue to talk that we hit some barriers in this work, some roadblocks that I don't think we were expecting. So I think going back,
I've heard a lot of states and the technical assistance cadres within states talking about this element of ready to change or readiness, and how assessing the current climate and how does one support change in a climate that might seem ready but has some barriers or whatever. So I think it's interesting that you stumbled on this question of readiness and what does it take for programs to actually change practice in your study. The other thing I really heard you saying during this opening part of the case study was about helping program administrators understand their data and their potential data sources, and even in the case you're discussing here, shoring up the data collection and expanding the different types of data sources that the program administrator was able to look to is what helped you be able to arrive at what are the weaknesses or the areas for improvement. And so I think that the two things that really resonated to me in what you said here at the beginning is the collection and use of data in program improvement, and this notion of the readiness and change agent part of the work. So I just wanted to call out that. I thought that was very interesting.
Absolutely. I'm glad that you kind of pulled that out for us, because I think that it probably is two of the most interesting things that ended up coming out of this work. And I was really lucky that, when I joined the faculty, that Zainab was leading this effort, because her focus on data, in each one of our meetings that we had with program administrator and staff, Zainab was modeling how to, collect data from the meetings too. And Zainab, I don't know if you want to share anything about that, but I just remember very large pieces of paper and then typing them up later and bringing them back.
Right. Thank you. Thank you, Debbie. Those are great perspectives. Kelly and I are so involved in this that we don't quite recognize those other nuances, and it's wonderful that you brought these. I also wanted to add one thing about, again, the context, and then help you, mostly administrators, QRIS, implementers, and states, to get something out of this. One was that the need to change, sometimes change happens, and sometimes change has to happen in QRIS systems. But I think what was important in this sense was that beginning, and while Kelly said, I led this effort and the practice and the assessment work, but Kelly, brought in the implementation science framework. And what it really did for us was that multiple stakeholders realizing why we need to bring this change forward, because everybody had different perspectives about why this needed to change. From the college administrator's standpoint, our dean has shared that the center is facing with budget difficulties, and thus we need to do something to increase our enrollment. And that was the perspective of this, fiscal manager in a standpoint and overseeing our budget in the center. And from the director's standpoint, she was just recently promoted to become a formal director at the center. She started as an assistant teacher, then she was a teacher, and then finally she was a director. And her career goal, although originally she wanted to have her own center, this was just what she wanted. So she's a permanent member of our community, and she's very established in her work. The center was a high quality, but she also had this need for a search for an identity for her center. Now she even personally identifies with. But for us as the implementation leaders, it was very important that we collect data from every perspective and we decide on the need for change. And it's, that's based on data, that's based on evidence, and that's based on where people wanted to go. So that's how we started. And I remember Leah, our center director, telling me in a conversation, and she also stated that in when we presented this work last year in MESI conference, she said that, well, coming in, I thought that you, as the faculty leader of this work, the program coordinator for early childhood, would come in and tell me, okay, we are bringing this change, because she was aware, that some change needed to be happening because of the directives that she got from our dean. But she told me, I thought you were just going to come in and say that, well, we need to change your curriculum, and here's how we are going to do it. And for her, obviously not having, trained in the in the formal leadership literature and how change, in the change literature, this was surprising that Kelly and I really wanted to take our time and truly take an implementation science perspective and collect data. So when we actually talked with Leah, she was extremely pleasantly surprised that we will value, respect, and integrate all stakeholders' perspectives. So they just helped her to recognize the value of the change and helped her to sign in on this work very easily and very willingly, because we were using a framework that was research-based and not really putting in our agenda for change. And so, Kelly, do you want to add anything before I go through the core elements?
No, I think that was a great addition. I think that was a good integration. Thanks, Zena. Go ahead.
Wonderful. Okay, so for the implementation team, we had the task to actively guide the process of implementing a new curriculum. We noticed that the earlier conversation, like Kelly shared, that we needed a new curriculum. That was how we were going to start with. The implementation team formed. It included early childhood faculty, the program administrator, and all of the staff. So in order to decide how the team would work, we had our expectations determined. We determined the number and the frequency of meeting, and we started with a weekly meeting, and then how we would conduct these meetings as well. So how we would expect people to participate, which was a very democratic style of involving everyone's voices in the meetings. And then we began meeting weekly, started collecting data to guide the selection of a new curriculum. So one of the data points for us included activities such as visits to our centers to learn more about high-quality, internationally recognized curriculum, such as the Bank Street School in New Jersey, the Family Center there in particular, University of Chicago's BAP School, and Reggio Emilia in Italy. So, and then some other community centers that are successful in their practices. And then also the team, different members of the team attended PD sessions about curriculum models. And so we collected data about the strengths of these curriculum models as one data point. And another data source came from the qualitative documentation of our meetings. Every word that was said was important. It was documented. It was used in the next level of when we meet and when we make decisions. And so that was how implementation team formed and worked together. The data and feedback loop piece was that includes, in the beginning, as Kelly mentioned, the assessment of readiness of staff. And besides that, doing the readiness to change scale, we included staff in meetings and, collected qualitative data on the following specific questions that were to be documented. So one of the questions was, what is our need or purpose for changing the curriculum? Why do we want to do that? What is my role in the teaching process as a teacher? What is my goal for children and families? What's my ideal teaching and learning environment? What's my role in children's lives? And when does learning happen during the teaching or during the day, during the instructions? So we collected these data from everyone, and we also collected data during, visits to our centers. We created matrices based on different curriculum components during our visits. Those components included environment, how they set up their environment, parent interaction, how was the curriculum play-based, and their assessment practices. And again, it was our pure intention that we arrived this work with a blank slate, and even though we had in the implementation team, we all had different agendas or different interests about what curriculum model was better, our past experiences with early childhood curriculum, we approached it very diligently, and we tried to be very objective as possible. And the curriculum components we collected within these matrices were selected. So we selected some curriculum components with what we think was best fit for our to be new curriculum. And then we also used the previous data collected in the needs assessment, demonstrating what aspects of the curriculum were important to stakeholders. And we continue to share these data at the implementation meetings and analyze this data. And then we have the implementation infrastructure that were set up. During the exploration stage, we focused on fundamental activities such as, these activities were to support the implementation infrastructure. They included planning to support practice, organization, and systems. So more specifically, the team worked to plan professional development about the work. The team began planning for faculty to integrate professional development and coaching across the program, which was currently missing from the program. The addition of integrated professional development would utilize existing resources to help the process of implementing the new curriculum and form a stronger connection between the center and the faculty department as well. Specifically, we prepared a professional development framework with 10 components that were, again, important to stakeholders and a timeline to implement these professional development components. And we also work to adapt administrative practices to support implementation as part of the infrastructure. So some of the policies and practices for supervisional staff were examined to help support the stability of the new curriculum. So we began to develop a program handbook with policies for staff, work for guidance, and how do you establish classroom community, what's their approach to guidance and, discipline. And another part of the, administrative decision-making to support the implementation was as part of, what everyone in the implementation team wanted to have in the center, we quickly recognized that we needed to open up the center to all of the community, Glassboro and surrounding communities besides Rowan community, because initially, as I told, we were just open to Rowan University community, and as part of one of our big ideas, which is the inclusiveness, we felt that we have to open it up to all community. Another an administrative decision that we planned but yet to implement at that stage even was exploring the idea of a sliding scale for tuition to be, again, more inclusive to students, to reduce it even more when there's an income problem, and to increase it for people who could afford it. We're still working on that. And then the last component was of the infrastructure was that we tried to align the curriculum to the philosophy of center. This was an interesting process because when we analyzed the data collected, it was very evident that the previous philosophy statement, which was just, again, like I mentioned, focused on developmentally appropriate practice being play-based, it did not really reflect the beliefs of the staff. It was more about this is how we do things. It was about the process. It did not reflect the beliefs of staff, faculty, and stakeholders. So to account for this new development, we have to actually go back. We went back to the original data collected in the needs assessment, and in addition, began examining other centers' philosophy statements as well. But again, the questions that I introduced a little bit earlier, like what's my role in children's lives, these questions and the answers to that really form our new philosophy statement. So a new draft of philosophy statement was created along with a one-sentence mission of the program. The philosophy statement was reviewed by the stakeholders, and then after revisions, it was adopted in our program, in our new program handbook. And then we reviewed the data collected on curriculum models, and then after that point, in alignment with our philosophy statement, the team decided on a curriculum model that's unique. It's not a packaged curriculum program, but that's the one that meets the needs of the all stakeholders. And at this point, we invite you to add or ask questions for the exploration stage. I see that Ronnie has a question. She said, do the presenters use a paper format guide to capture all of the components of the implementation science?
Yeah, so that's a great question, and it's something that as we've been working on this and developing this, we have a couple, almost like, I don't want to call them worksheets, but forms that can help guide that process, and one of them we can share with you guys after this presentation. So we have been trying to be very intentional to make sure that we're incorporating all aspects of this, and it does, having it written down and having a sort of format to follow has been very helpful. We also have been piloting this with another group that we're working with, a group of supervisors actually, and using a similar kind of worksheet format, and it's been very helpful. So yes, we will also send you a sample of that after this. I also see that there's a question about how long did the exploration stage take. Well, I think my first reaction is much longer than I expected. What about you, Zainab? I think it definitely was longer than we expected.
Yeah, I think our exploration stage, and we need to understand that some of the ending process of the exploration stage blends a little bit into the installation. So I would say that our exploration stage took a year. Well, at least an academic year. We started in the fall of 2014, and by the end of spring 2015, we had the PD component completed. We have had made the decision of curriculum, but not at that moment exactly. Things were unfolding one after the other, so all of these processes happened, and some of the decisions were made by the end of fall. Some of the decisions were made by the end of spring, but we had a clear implementation plan that we submitted to our dean of the College of Education by the end of spring. That stated exact steps that we would take and the stages.
Yeah, and I will say that while I know a year sounds like a long time, it does align pretty well into the 2 to 4 year expectation to really scale up a program. And I think that some of the hardest work happened in the exploration stage, and I think it's serving us well as we've been moving through the other stages as well. So if there's not any other questions, I'm going to move on to share a little bit about stage 2, but please still consider, write something in the chat box if something comes to mind as we're going through this as well. And we'll pause again after stage 2. So entering into stage 2, this installation phase of implementation science, during this phase, typically the program administrator will be putting into place the actual supports that are needed for the change, or will also help to develop part of the initiative or program as well. So they'll be putting into place the changes or the developmental pieces that need to go into the actual program. And during this phase, structural and process changes will need to be made at the program level. In order to do this, the areas that are typically addressed have to do with these 4 areas. The first being human resources, which is, about staff, recruiting, coaching, assessment, financial resources, funding acquisition or any realignment or budgeting changes that need to happen, and then policy and procedural development that really does happen at both the structural and the process levels. And I think you probably heard us kind of talking about some of that, because especially within our system where our center is based, there's multiple levels of the system that it's existing in as well. And then also any reporting mechanism for outcomes as well. That's really what we're primarily have been working on in the installation stage. And in order to account for all of this, we again have this all couched within the 3 core elements of implementation team, data and feedback loops, and implementation infrastructure. And Zainab's going to share a little bit about what we did while we were in that stage.
In the installation stage, the implementation team continued to meet on a regular basis. So after this first year, we met either weekly or bi-weekly, so it wasn't as condensed. It wasn't as intense because, like Kelly said, a lot of the heavy work happened in the exploration stage where we were making ground decisions about the curriculum. So staff continued to attend professional development about the curriculum based on the 10 components of the PD plan that was created. And then the implementation team also developed plans to begin to integrate the pieces of the curriculum into the center. So again, this work, because it is following the needs so closely, we started with the immediate pieces and what could be feasible for staff time and the center's need at the time. So the pieces were started to implement it slowly, gradually. This included constructing some timelines about, when would the training PD would happen, when would the modeling practices, observations would happen to follow up and support the coach the process. And we also continued to study our own process through utilizing ongoing data collection, anecdotal notes, codes, lesson plan samples, and informal conversations with the teachers. And then in terms of data and feedback loops, we began developing reporting mechanisms for the outcomes. So that's a part of the framework. Integrating reporting and developing a data collection plan includes sources such as lesson plans, meeting notes from the coaching sessions, observation assessments such as ERS and class, and ongoing stakeholder surveys to families. So in a way, this is provide us feedback about how these changes are occurring. Other sources of the feedback were university administration and faculty, who would also observe different aspects of the change. A small subgroup of the implementation team examined the financial resources of the center. It immediately, again, posed the challenge for us that financial resources were not as good like many other centers. And the budget was reviewed with program administrator and university administrator, which then resulted in additional fundraising efforts, which still to date continues. And in terms of implementation infrastructure, the team focused on fundamental activities that will continue the development of infrastructure. Those included planning to support practice, organization, and systems. More specifically, we had several activities to accomplish that. One was support human resources. So the program administrator began actively recruiting new staff with job responsibilities that then align to the new philosophy and curriculum instead of having a generic job description. This really garnered interest of fewer but more interested staff, and when we made the philosophy and the mission very explicit. The second type of activities we engaged in was developing professional development. In partnership with faculty, observation and coaching practices, and in tandem with a series of professional development sessions on relevant curriculum topics were developed. So some of these practices included shared book readings, open discussions, and regular check-ins to follow up with the decisions. And another component was adapting administrative practices to support implementation. At that example, we had policy and procedures development began at the both structural and process levels. So policy and procedures at the structural level usually addresses issues such as child-to-adult ratios, group size, teacher qualifications, and professional development. Obviously, a big change was we then had higher expectations for teacher qualifications, professional development, obviously for the expected required engagements such as viewing teachers as part of our philosophy was viewing teachers as researchers and as observers and guides, and that included obviously readings and reflecting on their professional practice. So that really required a specific level of education and experience and reflected practices background in staff. And obviously professional development. The process changes that was addressed by the team included how teachers and administrators basically do their work. So some policies regarding how do we provide sensitive and responsive caregiving, how do we differentiate teaching practices, how do we implement developmental and culturally appropriate practices, and health and safety practices are, those are some examples of the process-oriented policy making in nature. So this process for us mostly included planning and developing curriculum policy for handbooks, lesson planning, team meetings, and reviews with coaches to, again, follow up with decisions made and how they're implemented, as well as modeling. In addition, the program administrator participated in reflective supervision training to help develop a system of supervision that supports the new philosophy and curriculum of the center that was more geared towards sustainability. So even if we are not there, we wanted to make sure that when the implementation team moved into the next phases and that the director is there to sustain the change processes happening. So and enabling and building capacity in those leaders in the program level is extremely important. And so the director had specific trainings just unique to this work. At this point, we want to stop, pause again, and allow questions. Do you have any questions? I don't see any in the chat box yet, but
well, this is Debbie. I think that one of the things that really resonates with what you're saying, I'm thinking as a state QRIS administrator here, would be the concepts that you're talking about are often the ones that those of us leading the change within states are working to support the technical assistance provider to engage in. So I guess a question that I'm thinking of for those out there in the session is, are we spending time with our technical assistance providers, helping them think through how to support a system of change by using implementation science, and are they adept? I find it interesting that you're at supporting all the different kinds of changes you're talking about, from the program management type of change that might need to occur with the budgeting to the classroom practice change. So I thought that the idea of supporting multiple areas of change within a program and helping a director tease out, the program administrative changes from the, classroom practice changes, from other policies that might impact how families were seeing or engaging with the program. So it's not one. At first, when you started the presentation, I thought, okay, we're going to talk about curriculum and change in the curriculum, which is an element of it, but it's not the only element. This group saw multiple areas that needed to be affected and impacted, and I think sometimes it's a challenge for technical assistance providers to be broad enough to help directors figure out how to move and change in multiple different arenas of the program, like you identified. But I'm just kind of pondering what you've been saying and thinking about that as a challenge.
Yeah, and Debbie, I appreciate you for bringing that point forward again. And yes, implementation science framework really looks at systems level change as well. So without the infrastructure, we cannot make the changes that we have been targeting. One example from our current work with the New Jersey technical assistance specialists that we have been conducting trainings for the groups, and one of the questions that came up is that always we have been using the work of Simon Sinek to set up a foundation that when he talked about you start with the why and then go to the how and then go to the what of the process. So to us, it's very important that, again, for buy-in and for bringing the team forward on one particular goal, and that exploration stage was so critical, because even though we recognize the change has to be on the curriculum, there's so many other elements, and the core elements are so tied to each other that you cannot make changes in the curriculum without making changes in all other aspects of the system, just like Brenner, I guess. There's a connection there. So thank you for bringing that point forward. Kelly, do you want to add anything?
No, I think that it is a really important component to think about with this, and I agree. I think that when we first approached this, though, I don't think any of us thought that it would hit as many systems as it did. I think that we thought that it was going to be a little bit more straightforward than it was, even though both of us had worked as program administrators before. I think we were still surprised by how many different areas it ended up impacting. But in turn, I think, and as we continue to share, I think it's really valuable, because I think it helps to stabilize the curriculum over time as well, that it's embedded in multiple systems.
I also wanted to add real quick that we did not approach our role in this process, and maybe I should have been more explicit in the beginning. It was not a supervisory role, and even though our administrators at the dean level, at the college level, provided this option of supervising the process, we we turned back and rebranded ourselves as coaches instead of having any type of administrator role. I think that really opened up this space where people would feel free to share their hesitations, and we have had staff really, rejecting some of the notions of, the new notions about what teaching and learning, as we have had staff that subscribe to old practices, some of the staff members, and they were free to raise those concerns without feeling any type of fear or worry, because that was how the process was led.
Yes, definitely. Thank you. I think that's a good point as well. So moving into stage 3, we're going to just talk briefly about where we are right now. So the initial implementation phase, it really represents the period of change. So this is where program administrators often find themselves serving as cheerleaders, a reassurer, a problem solver during this phase. It's really important that they're maintaining resilience during this change, as it can be really difficult for everyone involved in the implementation of a new initiative. And it's really critical during this phase for the program administrator to focus on the program goal and to encourage open communication, feedback loops, and also ongoing reflection. We know that feedback loops are necessary during every phase of implementation, but are really especially critical as a new program or activity is being launched. So the feedback loops are very intentional communication strategies and processes that provide an opportunity for team members and also for stakeholders to discuss how these new policies, structures, and procedures are truly affecting their practices. And being able to allow that space and that time for the feedback loops to inform the ongoing implementation is really critical in order to maintain the goal and to reference the goal. So just as a point right before Zainab shares, this is where we are right now in the implementation process. We are in the initial implementation. So as we're entering this phase and as we're kind of in it right now, we've tried to be very intentional about what we're doing from those 3 core elements, again, the implementation teams, the data and feedback loops, and then also how to support the implementation infrastructure. So Zainab, if you want to share a little bit about what we've been, kind of where we are and what we've been planning for.
Sure. So for the implementation team component, the team continues to meet regularly at the stage where we are. The frequency of the meetings slowed down during the summer months and then during the break. However, the team continues to work within the same expectations, both accountable for the action items. And the team has focused on the use of improvement cycles for communication and staff development. During the year, I will also say it slowed down the frequency, but it's regular, like every 2 weeks, every 3 weeks. In terms of the implementation of the curriculum, the main charge of the implementation team, it hasn't occurred at the expected timeline for the center. So that's an interesting take on for this work, because we really believe that, highlighting these where we are stumbling upon is also important, for modeling this work. Part of the slowdown in the implementation of our curriculum was the result of the staff turnover and the needed time for hiring, and we're talking about a part-time position that's actually the lead teacher position in the other classroom. I should also mention that Leah, the center director, is also a lead teacher in the pre-K classroom for half a day. So the implementation of the team accounted for this by focusing their efforts on the recruitment of a newly developed joint position, because the initial position was just like an hourly teacher, lead teacher position, and because of the budget limitations, this has been an issue with the staff turnover. So the team had to integrate a new member each time and train them to the level of where they could function again. So we developed a new joint position. This is a part center staff. They would teach half day at the center, but they would also teach one course for the program. And that's still part-time, but an instructor position. This is an elevated yearly salary position in the college. So the team created this position, and it was also supported by the college administration. The new staff has at this point joined the implementation team and is a key player in the implementation of curriculum just because, again, like she's from one of the very successful Abbott districts. She just left her job as a pre-K teacher to have some flexibility in her work. So now we have both our director and the other lead teacher has their master's degree. And in terms of data and feedback loops, during this stage, the team is creating feedback loops between the staff, program administrator, faculty, administration, and families. Feedback loops are, for us, intentional communication strategies, and that will provide an opportunity for us and the stakeholders to discuss how the new policies, structures, and procedures are affecting new practices, and allowing space and time for the feedback loop was critical for us to meet those goals. And they're especially critical as the new changes are being launched, and so then our team, the implementation team, has set communication expectations and roles for the team members. The program administrator is actively communicating with families to share the progress of staff hiring and the implementation of the new curriculum. In addition, one senior faculty is designated to communicate directly with the university administration on the process and to be a conduit for approvals and questions. And they both share communication activities with each other and then report back to the implementation team. The team continues ongoing data collection. Again, these include lesson plans, teacher observation by faculty, observation of children and interactions, the use of more formal observations such as the class, and the center has just, again, as part of the implementation stages, I think it was in the installation stage that the implementation team decided that they would adapt teaching strategies goals as the assessment system. However, the first initial set of training is still being conducted for this, so this is a new work. In addition, there are plans for more comprehensive data collection, which is additional tools that we value. The data will be collected about fidelity of curriculum implementation, including the lesson planning practices, teacher practices, and stakeholder feedback. And then the implementation team will evaluate a more formalized assessment procedure for stakeholder feedback that will be recurring for families and community, etc. And then all data will continue to be used in the help us problem solve and continue to improve our implementation. In terms of the infrastructure, I wanted to talk a little bit about the center administrator's role, program administrator's role, because those are fundamental activities such as planning to support practice, organization, and again, like systems work. So we recognize that our director displayed characteristics of both technical and adaptive leadership. So in terms of technical leadership, the program administrator worked with this, with a setting with layers of administration and integrated data and feedback loops within the implementation team. They have become very valuable. These skills and characteristics have become very valuable for problem solving during initial implementation, especially with staff turnover. The administrator recognized the challenges of staff turnover and in partnership with the faculty member developed this joint position to help stabilize the key position within center. Further, we recognize that the program administrator displayed adaptive leadership characteristics because she continually supported communication with families during the delicate time of staff turnover via email, face-to-face, by connecting this issue to a need for highly qualified staff for our center.
All right, great. And does anybody have any questions about this particular stage that we're currently in? Please feel free to write them in the chat box, and we can also come back to them after we finish this stage 4, if that's helpful as well. So move on to stage 4 just for time. So stage 4 is really about the final phase of implementation called full implementation. And one of the ways that you know that you're in this stage is when you and your staff are consciously and unconsciously confident. You're following protocols automatically in following new policies and in implementing new practices. And so when program staff realize that they no longer have to think about doing the right thing or following the right procedure, then the change is fully integrated and full implementation is realized. So it's important to know, though, however, that full implementation does not imply that the work can stop. And so that we know that programs are committed to high quality, they must maintain these feedback loops, ongoing assessments, and then pivoting and having those those as-needed modifications. And during the implementation phase, a program should begin to see movement towards the desired outcomes. That's something else that you should be able to see within this stage. So as we talked about a little bit earlier, just briefly, implementation does not happen overnight. And so we really have been trying to be intentional in looking ahead, and so trying to think and be proactive about, well, what happens when we reach this stage of full implementation? And how are we going to be accounting for these 3 elements? So we have brainstormed and have written down with our implementation team some of the expected roles or integrations of these 3 elements that Zainab will share with you all now.
And again, because we're not at that stage yet, we have some, estimates about what might happen, and we will need to continue to meet at whatever frequency that the team needs to get to our goal. And then at that stage, we will be assessing our purpose and focus again, and how successful are we to meet those, again, using data. In terms of data and feedback loops, the team has planned to continue to collect data and to integrate new data points depending on what is the frequency. Is it going to be, integrated monthly, bi-monthly, quarterly? And the things that we are going to be looking at that stage is the curriculum being implemented with fidelity? Are they meeting the goals of the curriculum? Are there needed enhancements to the curriculum? And then depending on the context and what's happening in the center, in the community, and in the university, we guess that there might be setbacks, there might be interesting developments. So that we're guessing that there might be enhancements needed that we would need to make the curriculum. And then in terms of communication feedback loops, the implementation team will be looking at if they are working, do they need to be adapted, and then in terms of implementation infrastructure, the team will continue to evaluate how is coaching working, are PDs effective, and if there's any more infrastructure that is needed to either budget-wise or technicalities and logistics of the programming. Do you have any questions at this point about the 4th stage? I don't see any in the chat box, but feel free to add. You could see that.
This is Deb. One of the questions that I was wondering was based on a comment you made about we'll have to make sure that they continue to, work in this cycle and in this approach. Have you thought about a recommendation out of your project about what you've basically done an inoculation here and a process here? What would a booster support or configuration maybe look like? Say that you were thinking about implementing a program like this at a state level or as a high level of support initially to a program. It will be interesting to see what you hypothesize about a booster shot for the program continuing forward. I'm just thinking about scalability, and if you had multiple programs, so to speak, maybe there's a community of practice or a way to associate directors together with a TA person to, after they've been through an experience like this, to have some kind of a way to, keep them, in the practice and improve their own practice about running this type of a project. It was just a thought about like scaling implementation of something like this. And another thing I was wondering about is, have you thought about cost associated with the type of TA that you've provided in this one setting? You know, like I'm trying to generalize and think about how could we scale this type of approach. I heard you discuss your measures of success. How you tell. So just reacting to scalability and like a bigger picture kind of a thing.
Mm-hmm. Yeah, so I think that's been on our mind a lot lately. And as Zainab had referenced earlier, we are doing some work in New Jersey with the technical assistants there. And one of the things that we're doing is, this was such an interesting experience with the center, that we are in the process of scaling up, well, not scaling up, we're in the process of starting some communities of practices with technical assistants. And we're going through it very intentionally following an implementation science framework with the development of some tools that we've designed with some guidance from some other references and people as well. And one of the plans is from there to have technical assistants, walk through the process of implementation science with us, create their own communities of practice, and then from there be able to utilize that in the field with their work with centers to then do the same exact thing. So teach them the format of, scaling up and something through an implementation science framework. So we're just beginning to think about this, what this looks like from the lessons that we've learned, which we can share with you guys in a few minutes, the major lessons that we've kind of pulled out of this. And then as far as the cost of the TA, Deb, I think that's the $1 million question. I think that's something that, we have not looked at, done a cost analysis or thought about that. I will say that it was a lot of hands-on work right now. And so the feasibility of this kind of very, very detail-oriented approach might not work well as it's scaled up. It might need to be pieces. So I think that we'll probably know more and think more about it after the communities of practice.
I definitely agree with you. There are lessons definitely here to inform a larger system building, and I'm excited that you're continuing to think about that. That's terrific.
Great. Okay, so I think I'm going to actually go to the lessons learned slide and then let some other people share if they'd like to talk a little bit about this, just since we started talking about lessons learned. So we're just going to very quickly go through a couple lessons learned, but then thinking about, especially what Deb was just sharing about the scaling up to a larger, statewide program or a regional program or something like that. We're really excited to hear your thoughts about these lessons. So the implications that we're drawing here are for program administrators and technical assistants. That's kind of the way that we framed this, these kind of specific implications from our work. And the first one is that the work during the exploration stage really does lay the foundation for the rest of the path towards implementation. So administrators really need to be able to study what's working and what's not in their early care and education settings, and then use this knowledge to change, modify, or validate the activities that support children and families. So to think about being inclusive, to really be taking the time to collect data from multiple stakeholders. And also, from technical assistance perspective, how can we teach administrators to do that? How can we model that for administrators? That's a valuable skill to begin to learn, that exploration happens, and sometimes, it can be very informative, and other times, it might end a process. The process might not be worth going through after you get through the exploration stage. That's kind of the key component in that data collection and the utilization of that data. And then taking the time to thoughtfully put together the implementation team helps when there are bumps in the path. This was foundational to our work and what happened with us. As soon as we started hitting these barriers or these bumps, we were able to turn back to our core implementation team, who was well-versed in implementation science, who was well-versed in different knowledge of the curriculum that was going to be, scaled up within the center. So having those people on the implementation team that have those core knowledge and competencies is really important. Also, really being clear about expectations of time and the action, and having feedback loops. I think that this is really important too. Having feedback loops that are transparent and inclusive really helps to not make this a scary process for staff, when sometimes change is very scary for many people. But the transparency of the process was helpful for them. Actively involving stakeholders in the process was an asset for us in multiple times during this process. And then, just learning that data, it's not helpful unless it's used to help inform the implementation process. So really making sure that those data-driven decision-making steps include collecting appropriate and quality data, analyzing the data, measuring and sharing the data with stakeholders, having that plan, do, review cycle embedded. All of those different components were really, really important to what we're seeing. And also, I think as a technical assistant, that again is an area where you can start modeling that for programs and helping programs with that. And then the other thing that Zainab and I keep finding is rising to the top in all of our analysis of what we're doing is how important that leadership plays an important role in staying on the path of implementation. That program administrator is so key, that they understand this process, that they are able to have technical and adaptive leadership skills. And then also that they are actively understanding implementation science. So that's something also to think about technical assistants' role in this. It's how do we help empower our directors to have that strong leadership role. So I'm going to stop here, and we'd love to hear any ideas that you might have, any ahas or questions, any strategies that could help, that you think that could help with this work or could help with your role in a QRIS or in any other setting, and also like what other further supports or resources could potentially be helpful as well.
As hopefully you're working on typing your commands in the chat box, I just wanted to add a few things to Debbie's comments real quickly. That I think one piece to think about is the sustainability piece, and I think in terms of technical assistant specialist work, we found that it's very helpful if any practices associated with implementation science is already embedded into their daily work and their work hours too. So if the systems level structure can be created for them, their work will be more meaningful and they could form these communities of practices. And then I think the other thing about when do you, step back in is, as the programs embark on this journey, is that we both believe in, continuous quality improvement, framework. So I think a regular check on the data and seeing where are the pitfalls, where are the improvements made, will help the team recognize what should we change or should we, go back and revise this concept.
Great. We have a comment from someone that they're very much interested in learning about tools to determine staff's readiness to change. Any suggestions would be appreciated. That's something that we can share out. We can share the listing of questions that we followed to use that, and then also the resources that we used as we were working on this case study. And that's something Zainab and I can talk with Debbie to make sure we can get out to you guys.
That's great. We'll be able to, Kelly, post it right along with the webinar posting on the webinar section of the QRIS NLN website. So when you get the link to this, we'll have some additional resources. And if you on the in this session have other resources that you think would be helpful that align with the presentation and this exploration from Rowan University, please send them along and we can post those as well for everyone in the session to, that would expand the universe here in terms of resources. So we're glad to do that. I think it is such a great case study because even though it was kind of from another angle, a university doing this with a program, that they wanted to help and improve and all of that. It's just so aligned with the case studies and the knowledge base forming at the technical assistance level throughout the states. It's just such a great example also of the use of this implementation science format to support programs. And I know there's, because really I think that you have a strategy here that is going to be important to sustainability of the continuous quality improvement loops, and you're really giving programs the framework or the format to keep going at that in a continuous way. And through, I think it was interesting that you illuminated some of the typical challenges faced in the work, such as the turnover of the staff and the reorienting people to what you're doing and what the plan is, and getting new people's buy-in, to where you've come already. And I think it's continuation of the feedback loops and them seeing that now they're part of a process that will continue to be modified based on now their participation, and that their engagement is required to keep going. Those are the kind of techniques and thinking that's going to really, be able to sustain the change and improvement at the program level, which is, I think, what we're all looking for. So I'd like to thank you both again so much for taking the time to present this today. We have Zeynep's and Kelly's emails here if you have direct questions, and if you have information, you can send it along to me, and I'll make sure that it gets posted on the website. Thank you all again for attending and your questions today, and thanks so much to our panelists and sharing your very interesting case study with us. We really appreciated it. And look forward to reading the report. We look forward to reading the report, too.
Absolutely. Yes.
Thank you. Goodbye.
Thank you. Bye.
Bye.